People always were surprised when I told them that I loved my job as a forensic psychiatry nurse. Working for 20 years with patients who had committed a crime and had severe psychiatric problems seemed hopeless to them. While it was true that we couldn't fix everything, hope was always a central part of our work. As hard as it could be, there were always a lot of resources available to us in the hospital. So when I moved out to a small rural community to start mental health nursing, and I realized how hard it would be to access resources for housing, food, income support, things that I didn't have to think about in the hospital, I felt hopelessness for the first time. One of the first people I met was a young woman with extreme anxiety. She would come to the office for her visit, throw up, and leave. There were more no-shows than actual visits, and it was frustrating for me after having a captive audience in the hospital. Eventually I told her, "You have my number, call me when you're ready." I still remember being surprised and happy when she called for the first time. She taught me if you wait by the fence long enough, people will meet you there. A few years later, I received another referral that seemed overwhelming. Income, housing, trauma, medications. How could I fix all this? In our first appointment, I found out that she had already accessed all the resources I had, and she was fine with her living situation. It felt like there was nothing more I could offer, but over several years of relationship with her, I slowly learned that all she needed was consistent connection. When she calls, she knows that I will point out her resilience and resourcefulness and be comfortable with her chaos. All of these important lessons seemed like preparation for 2020. The night of the first lockdown, I texted my team. We knew things were going to change. All of the resources we referred to were gone. People were laid off. Doors were physically shut. Nothing was in our control. No one was immune to the impact of the pandemic. Patients who had never worried about income or jobs were now faced with these obstacles for the first time. They were ashamed and confused and overwhelmed. Some said they were feeling a little stress and then broke down and cried the entire appointment. They were worried about getting sick and passing it on and not being able to provide for their families. I knew in these moments I couldn't fix anything for them, but I could meet them at the fence and point out their resilience. The pandemic taught me that it is arrogant to think that we as healthcare providers can fix everything. But the beauty of working in a small town family clinic is that we truly are all neighbors, and we have a lifetime to support each other's health. We really are all in this together when it comes to creating healthy communities. We can always meet people at the fence.